Hello, it's Tuesday, and do you know what that means?
It's our favorite day.
It's Trash Talk Tuesday, and we are here to trash some stuff today. Lately, we've been on railing other medical providers in other states, I feel like, because there's just been a lot in the news about it. You ready for this one?
Yep, bring it on.
So here's the deal. So of course I got this from ABC Health. I will post the link below. So Ohio doctors ordered potentially fatal doses of pain medicine given to at least 27 hospital patients were carried out by employees who made poor decisions and ignored existing safeguards. This is from a hospital administrator. So basically what happened is the hospital system fired its intensive care doctor and reported findings to the authorities that has put 6 pharmacists and 14 nurses on paid leave pending further review. So I've got a question, but I want to read you one more thing. So apparently this isn't the only time it's happened, okay? It says the announcement involving patients from the past few years were raised, whether or not these drugs were used to hasten or intentionally, or to hasten deaths and intentionally or possibly illegally. So either they were trying to do it or they didn't mean to do it. But the theory might be that they're trying to hasten the deaths of some of these patients, because there's at least 4 lawsuits out there about patients who have died because hospital employees negligently or intentionally gave inappropriately large doses of the powerful painkiller, fentanyl, and the families weren't aware. So one example, and then I'll shut up. One example, this family accused the hospital, this woman was 65 years old, so not old at all, of withholding information about her prognosis that led her family to believe she would die naturally after being removed from life support, and didn't disclose that she was given a lethal dosage of fentanyl. So the theory here is they're ignoring, well, they know that some of these are ignoring safeguards, but apparently this is like happening. And people are starting to wonder, is this happening to intentionally hasten the deaths of some of the individuals in the hospital? Why? And my next question is, why would they ignore these safeguards in place? And what are those safeguards?
First off, safeguards are where you can't give somebody inappropriate doses of pain medicine that will have a detrimental effect to them.
Yeah.
Okay? So that's a safeguard. Now, why it was ignored was to hasten the death of somebody that has a non-recoverable condition. Okay. So say they had a stroke and wiped out 90% of their brain. They're not coming back. Okay.
Yeah.
So how long can somebody live off a ventilator that has wiped out 90% of their brain? I mean, you'd be surprised, Michelle, they can actually go on for weeks.
Really?
Yeah, they're brain dead, but they'll live for days, weeks. I mean, it is certainly possible. And the only thing that's functioning is your brain stem, which is about that long, that wide. The base of your brain's the last thing to go. And it's relatively well protected. It's what they call a primitive function. Your primitive function is heartbeat, breathing, those kind of things. And so it's literally the last thing to go. It's the first thing you're born with, but it's the last thing to die. And but it can take some time. It has to be overwhelmed before it'll do it. It's kind of like when you hold your breath and you get an overwhelming sense of urge and you just got to breathe. That's your brain stem doing it. Mm-hmm. So, the safeguards were ignored for those reasons. I personally believe, not knowing anything about the article, doctors and pharmacists, especially a lot of them, they wouldn't intentionally do that. Everybody thought it was the right thing to do. And I mean, I'll be honest with you, I was in the hospital, all right, so what, I'm going to die of natural causes, which means I'm going to die agonizing.
Dragging it out for your family.
In an agonizing air hunger type of thing and be suffering. Or do you want to give me a
blast of fentanyl?
A blast of fentanyl to see me off the rape, I mean, I'm not going to go with the fentanyl. Now, I'm not condoning what they do. I think what they should have done is ask the family, hey, is this okay if we do this? I mean, this will be nice, they'll be comfortable.
But isn't that like assisted suicide?
It certainly is assisted suicide.
And that individual, if they can't participate in the decision,
but the individual can't participate because the individual's already dead.
But
the
then
body hasn't given up
That's
yet.
why there are legal measures set in place before.
Because we have determined what is truly the patient's wish and what is truly death.
Yes.
Okay.
So what should happen is if you have some type of directive for your care or for the
There's nothing you won't find.
completion of care.
No. You'll never find anything like that in there.
But you wouldn't, because it's illegal to
Sure it is.
assist with basically killing a person.
It is.
Now, do I think it's humane? Yes. Do I think that it's wrong not to include the family? Yes. Here's my next question, actually more of my problem. How messed up is it? There's literally legal fights all over the place for people who are trying to get the rights to basically complete a medical suicide, medically induced through medicine, some type of medicine, suicide in Washington State, or Oregon, was it? Anyway, all over the place, but it sounds like it's been happening at the hands of doctors, potentially, for a while.
Yeah, I'd be interested to know.
What are those numbers?
I think the numbers at this particular location are going to be a lot higher than these people.
Yeah.
And I suspect a lot of times, what they haven't asked is how many patients' families have they actually gone out and talked to. Hey, you want me to hasten this and help it along a little bit,
And is that even legal?
No, it's not illegal, but is it the right thing to do?
First, do no harm.
You're not doing any harm.
I'm just saying.
The body's dead.
Oh no, I'm not saying that. Actually, I'm not even trying to have an opinion here, but I am just saying, isn't that absolutely, number one, illegal and against what you're supposed to do?
Yes.
Yeah.
On both accounts.
Yeah.
And they shouldn't have done it. And I'm sorry, these people, their families and their loved one who has a non-survivable condition is going to die in a massively horrible death.
Yes, and that's terrible also.
And if that's what you want,
then let it just happen naturally.
Yeah, that's what it is, And to make matters worse, if there's nothing we can do, well,
let's rack up those hospital bills.
Back up the pickup truck, let's load them in the back of the truck, take them home.
Yeah.
There's nothing we can do
Well,
here.
and not to mention hospital bills. I mean, that those will continue as long as you are alive.
We need to sort this whole thing out. We need to sort it out.
It really is a
right away.
mess, isn't it?
It is. We need to sort it out. And, we need to be realistic about it. I mean, I've been involved in enough healthcare issues like that where it gets really messy and really confusing. And even though the doctors are doing the right thing, they're doing it for the wrong reasons. And it just needs to get sorted
Yeah,
out.
I agree. This is a weird one. I'm not sure how to feel about it.
Yeah, so I'm kind of...
I mean, I don't judge them for it. The part I do judge them on is that they should have talked to the individuals, because here's the other problem. You have a lot of people out there who don't quite fully understand what they did, and so now as a result they think, well, she was alive still.
Yeah.
Have they realized, no, but then those are the people who, it's like, fine, then we're gonna keep them alive and this is gonna drag out. And, it just,
It's very much a patient and physician
Yeah.
type of relationship that's going on here. I'll be honest with you, the last thing I want to hear from is some CEO of a hospital. If you're a CEO of a hospital involved in something like that, do us all a favor, be original and shut the hell up. And don't say anything. Because I don't even want to hear your comment. Go back to your office, count your money, get your bonus,
They're like,
get your
well, the
paycheck.
policy says-
because you ain't got nothing to do with the damn
Yeah.
medical
Well, and
care.
I mean, the fact is that the relationship between the patient and the doctor is one that I think is personal and private,
It is.
and it gets really tricky when you're in that type of hospital
It does.
environment with, especially these big hospital systems where there are just rules in place. But I get while there are rules in place.
I don't think the doctors were doing it to hasten the death and get rid of the hospital bill. Because even if I was an employed physician, we got hospital bills we have to worry about, but I'm just doing the best I can under these situations. And I wouldn't do something like that. But at the same time, I don't think they did it for that reason.
Yeah.
I thought they
They
probably
probably did it just because.
because there's nothing else we can do here. And this game of life is over.
Yeah.
So let's put our cards on the table and let's move on.
Man, that's a weird one. This was an interesting one.
Yeah. So
Yeah.
it's not really trashy, but I feel for the guy.
It's a little trashy,
I
but
feel
it's
for the doctors and
stinky in a
pharmacists, because
different
I
way.
think they might have done the right thing for the wrong reasons.
Yeah, right thing, wrong reasons, get the right people involved. And honestly, we should get the legal part of this figured out. What are the rules here?
Mhm.
If it's a person's life and they have a decision on what they'd like
Oh
done,
my God.
then
You're
we
gonna-
should honor those
You're gonna
wishes.
ask 100 people and you're gonna get 100 different answers.
Yeah.
And This will never get resolved. It'll be just as dysfunctional as our government is right now, so.
Yeah,
nothing will happen.
that's why I'm gonna stay inside.
Yep, and unfortunately, these doctors will probably lose their license, and they're probably good doctors. The pharmacists are gonna lose their license, the nurses that were involved, they're gonna lose their license, and for what? They're probably all decent, reasonable people, and once again,
Yeah.
they did the right thing for the wrong
Yeah,
reasons.
and you know, the interesting thing is, it even says on here, sadly, it basically said, good people make poor decisions. That's what they said.
I don't say they're,
I don't know that they're poor, they just made decisions that, good people made decisions that will lead them to an outcome that was probably not favorable for anyone.
yeah,
All righty.
did the right thing for the wrong reasons.
Cool.
Thank God our government did, or we did that with the British 250 years ago.
Yeah,
Right? Did the right thing for the wrong reasons.
I think.
Yeah, sign that constitution, they're all traitors.
All traders.
Yeah, they're gonna be convicted and hung if they ever caught.
Yep,
And here we are today. That's
Here we
what's
are
right there. Yeah.
yep,
Did the right thing for the wrong reasons. Sometimes it works out.
sometimes. All right,
Have a
well,
good
there it
Tuesday.
is. Have a good Tuesday, guys.
See you next week.